little known fact, my actual first job was in pediatrics. I eventually became CEO of that organization, and all those parents of those chronically ill pediatrics were always asking me advice about insurance and policies and care for their children, and I would always encourage them, like, if something's not working for you in the system, you got to get your voice out there. But then what I started doing, because some parents aren't comfortable asking for advice online or looking things up, if they asked me a question, I would answer it publicly, and then other parents came. So when I left the pediatric space and went more into health IT and as a strategist role, I started doing the same thing for that area, and I just keep it up. And so now I'm working with doctors, getting their voices amplified on social media and that type of thing, and they're really embracing that. But I think it's important because all those little components of the healthcare system, if they're all sitting in different corners, quietly having their issues and trying to solve their problems, we're not all gaining. So when we all can come together in whatever way, socially or whatever, all of society benefits. So that's why I thought it was important to get these different little voices out publicly, and where you can say something, then let's discuss it. Like one of my favorite chats, and it's a huge success, is a healthcare leader that's done every week, and we talk about amazing issues, but you have takeaways from that you can actually go, and it's actionable insights that you can go and do something with.
No, and I love that idea. And for me, as I look at it, my effort is, how do I amplify the patient voice, right? Because a lot of the patients don't have the amplification, and they have the stories, and they're willing to share.
Right.
But being able to give them a platform to share that message. So for us, we've done on Healthcare Scene a whole series, and we should do more of it. Certainly, to share some of my weakness, we should do more. It's something we can work on, but. We've basically, we tell them, just tell us your story.
Tell your story. Mm-hmm.
They're like, oh, what should I write about? It's like, it's nice if you have some technology overtones, since that's our audience, but just tell your story and your experience unfiltered. I'm not I don't have any agenda.
Right.
I just want your voice to get out, and let us share it with our community. And then I also host the HITSM Twitter chat, which is every Friday. In fact, it's in a half hour. I'll be I'll be tweeting from here remotely, but we, about once a quarter at least, we try to have a patient host the chat and bring something from their perspective. So that's just another thing we're doing, is how do we amplify the voice of the patient.